Hello class. So apologies that nakat yung discussion. So I was about to hindi pa naman finish. Medyo pa start pa lang naman yan but sa sad to say wala palang audio. So apologies for that. So this is a continuation of the discussion. So that's just a slight talaga, no? It's a slight introduction on drug interactions. So as mentioned in the video, no? So when we talk about drug interactions class, it has something to do with the effect of one drug to other drug. Okay, like for example, this is drug A, drug B, and drug C. Let us say drug A, drug B, drug C. Yan. So, in the presence of drug A, okay, and if it is taken concurrently or magkasabay with drug B and drug C or kahit dalawa lang or more, okay, so drug A, okay, might have an increase or decrease in the efficacy because of the presence of drug B or in the presence of drug C and vice versa. Okay, so that's just a simple definition of drug interactions. So drug interactions are said to occur when the effects of one drug, okay, are changed by the presence of another drug on herbal medicine, food, drink, or some environmental chemical agent. Okay, so when we talk about in the presence of another drug, just what I've said earlier, it might have an additive effect. If it's a pharmacodynamic, no, it might have an additive effect, antagonistic effect, or synergistic effect. Okay? And then for pharmacokinetic naman, so there might be an increase or decrease in the absorption, in the distribution, in the metabolism, and excretion of the drug. So if there is any change in the presence of another drug, so that means there is a drug interaction. So remember, class, drug interactions do not just happen in drug to drug. Okay, so it might also happen for drug to herbal. Okay, drug herbal interaction. Okay, so we know that a lot of yung mga networker, 'di ba? A lot of them say that they are herbal medication, they are organic, they are natural. Yes naman, most of the natural products naman do not have side effects. However, there are some instances that herbal medication might affect, okay, the pharmacokinetic or pharmacodynamic property of the other drug. So, we need to know, di ba, in the patient medication profile, we need to ask the patient if the patient is taking herbal medication. Okay, because it might affect the pharmacokinetic or the pharmacodynamic of the other drug. Okay, and then next is drug food interaction. So, yung drug food interaction, this one is usually no we hear this sa mga ating elderly sa bahay, 'di ba? Mga lolo, lola, our parents, 'di ba? They usually say that you have to take medication, you have to take food before taking a medication, which is true in some medications, lalo na for analgesic medications and acid-containing medications like mefenamic acid, tapos ibuprofen, 'di ba, NSAIDs or analgesics, as well as yung mga, there are some drugs that should be taken with food such as yung macrolide, yung erythromycin. Okay, so it should be taken with food. However, we know that anti-diabetic agents, okay, other some of the anti-diabetic agents should not be taken with food, and also some anti-tuberculosis agents. So, share ko lang, during when Calix was about 1 year old to 2 years old, no, he had or he was diagnosed with primary complex. It's like tuberculosis for children, no? So, dapat walang food, di ba? But then, napakahirap talaga niyang painumin. So, whatever we do, wala talagang mangyari. As in, we tied him up using yung kumot, no? Lima kaming may hawak pero still hindi namin kaya kasi talagang niluluwa ng bata. Siguro nagsawa na rin because that's a treatment for about 8 months, no? Supposedly it's just 6 months. However, in-extend kong konti because of yun nga yung food. Ang ginawa ko kasi class is during his sleep, hinahalo ko yung gamot niya. So since the anti-tuberculosis medications are affected by the presence of food, so what I did was I just made a simple increase, slight increase in the dose. Bawa 5 ml dapat siya, I increase it by 1 ml. Although that's just an estimation lang because I really don't know how food will affect the absorption of the medication. Kaya lang, kaysa sa wala. So, by God's grace naman, nag-heal si Calix with the primary complex. So, in some special cases, class, huwag tayong sobrang, ay, hindi dapat. Okay? So, but of course, when we counsel patients, kailangan talagang pilitin nila. Okay? Because, yun talaga yung dapat. Because it will be absorbed properly without food. Yun nga lang, special case nga lang yung kay Calix no'n because we tried everything that we can kaya lang ayaw talaga. And then nung huli, tina-try na namin ihalo sa Yakult, sa Dutch Mill, sa Mango, wala talaga. Nothing is effective. Siyempre nalalasahan ng bata. So, during his sleep na lang, dun ko na lang siya pinapati. Okay, so regardless of the time na nun, during that time 'no. So, there are some cases 'no, sabi nga 'di ba, for every rule there's always an exemption. So, that's an exemption. So, before, na-mention ko nga dun sa doctor, unintentionally 'no, I mentioned it to the pediatrician and then she said na parang wala daw kaming ginawa, wala daw akong ginawa kapag gano'n yung ginagawa ko. Of course, I was there 'no, as Calic's mother. Hindi ko naman masabi na although alam niya pharmacist ako, pero ayoko naman na ipamukha kay doc 'no, since yun nga, nandun ako as a mother. So, I just, ignored na lang na yun nga, hindi siyempre 'no, hindi naman sa wala akong ginawa kasi meron pa rin naman and I increase slightly the dose because the absorption is affected naman. And I also consulted another yung may-ari ng Manor si Doc Ator si Dr. Imasa. Okay, so yun. I asked him kung kailangan ko bang mag-repeat ng one dosing regimen. Kasi nung unang months, okay pa si Calixon. Tapos nung huli, ayaw na niya talaga. So yun, hindi naman daw. It's not that the absorption, the decrease in the absorption is not that significant naman daw if it is taken with food. So yun. So, and then, yun nga, that's the time talaga na dun magpapasok yung pagiging pharmacist natin, 'di ba? Because some physicians, although they are physicians, no, since hindi naman nila forte din yung pharma. I mean, they are physicians but then they are not pharmacists, no? Pre-med nila, possible medtech, possible nurse, 'di ba? So, may kanya-kanya tayong forte but then yun nga as mentioned no we are drug experts, that's why we need to prove them that we are drug experts. That's why some of you who would like to take up medicine in the future, this would help you no and determining if there is any drug interaction habang nagre-reseta ka, alam mo no as because you're a pharmacist. Okay, so yan, some drinks may also affect, okay, yung interaction, magkaroon ng drink interaction, no? And some environmental chemical agents. Okay, so drug interactions are increasingly important cause of adverse drug reactions. This is very true because of the presence of many drugs, no? Polypharmacy. Of course, when the patient is a geriatric, lalo na kung geriatric siya, no? So there's a big possibility of possible adverse drug reaction because of drug interactions. Okay. So next, so when we dispense medication, okay, against a prescription, a pharmacist should always consider the following points. Okay, so the patient's age, like for example, no, yung age of the patient, geriatric patient or neonate. Remember, class, the liver and the kidney, okay, of a geriatric patient is not the same as the younger. uh, or young adult or adult. Because as we all know, 'di ba, as we grow old, syempre just like yung mga sasakyan, 'di ba? Kahit gaano ka kaalaga, but 'pag nasa old age na rin yung patient, kahit whether you like it or not, possible na meron na rin nagde-deteriorate na rin ng ating health even though alagang-alaga. Okay, and then for neonates naman, some neonates, no, their livers are not yet well developed or fully developed. Like for example, 'di ba, the liver is the major organ for metabolism, and then the kidney is the major organ for excretion. So if the neonate's liver is not yet fully developed, then the enzymes responsible, 'di ba, for the metabolism of drugs might also be affected. It might cause toxicity to the patient if the enzymes are not yet um baga the liver is not yet fully developed, so hindi pa nakapag-produce ng madaming enzyme yung baby. So, that may be a problem. So, that's why it's very important for us.
Until it the Ruben from the body.
Okay.
But
Okay.
if it's developing, then it got done.
Okay. So, yun. May sumingit na bata, no? About the liver. Okay. So, we need to know also the patient's condition, like the liver disease, or if the patient has cirrhosis, for example, no? And kidney disease. Because those two are the most important organs, 'di ba? And in our body, because when taking a medication, the metabolism and the excretion are very important. Diba? So we need to determine the patient's condition. Like for example, if the patient has a liver disease, it might cause toxicity. Diba? If, for example, kulang na siya ng enzymes. So what do we expect? Diba? Anong mangyayari dun sa pasyente? Yung kulang na yung enzyme niya. Yung enzyme, yun yung responsible for the metabolism. So, if kulang yung enzyme, kulang yung magme-metabolize ng gamot, so possible magkaroon ng accumulation of the drug. So, kapag mayroong accumulation of the drug, then possible toxicity, 'di ba? So, we need to consider this when we are dispensing medications, okay? And then other medications, of course, we need to determine for drug-drug interactions nga, and then the dose of the medication. In drug interaction class, remember that we can still give, okay, two drugs that are interacting with each other. We just need to determine what type of interaction it is. Like for example, kung pharmacokinetic ba siya or pharmacodynamic. So later on, we will discuss those two, pharmacokinetic type of interaction or pharmacodynamic. So the drug interaction of a drug might be prevented by time interval. Okay? Pwede yon. But this is only true for absorption. No? Kasi nga, halimbawa, uminom ka ng gamot, tapos nagugutom na yung pasyente or yung baby, kailangan painumin ng milk. So, pwedeng magkaroon naman ng interval to prevent the interaction of milk or antacid, for example, with the antibiotic of the patient. Okay? And then, also, sorry. Okay, and then for this, nasa na ba ako? Okay, and then another way class, no? First is possible time interval, no? We can have a solution. Okay, we can have a solution, or the remedy for drug interaction is time interval if the absorption is the one that is being compromised or being affected by the drug interaction. But in cases of metabolism, of course, ano ba yun? we cannot we cannot command, okay? We cannot tell our liver to stop producing more enzymes, right? So, since kapag ganun yung nangyayari, we have to adjust the dose of the medication. Okay? So, excuse. Okay, so there. So, those are the things that we need to consider also when dispensing a medication. Okay? So yan, yung mga food drug interactions, drug herbal supplements, no? Interaction, drug environmental factors, drug laboratory tests, and drug disease interactions. Okay, may nagpakain ulit sa akin. Okay, so for the factors contributing to drug interaction, okay, so of course it is for yung mga multiple prescribers, di ba? For geriatric patients class, for geriatric patients, we cannot prevent this, no? Kasi nga yung mga multiple prescribers, syempre hindi naman nila alam kung ano yung nareseta na sa kanila. So, yun nga yung that's why that is our role, no? Although some physicians or most of the physicians are asking their patients kung ano yung mga tinitik na medication. However, minsan hindi naman naaalala ng pasyente, especially if they are geriatric patients, no? So, ito yung factor, isa sa mga contributing factors in drug interaction. Multiple prescribers. And then use of non-prescription medication. So sometimes yung patient, if you ask them yung ano yung mga tinitake niya medication, yung mga naaalala lang nila is yung mga nakareseta. They tend to forget the non-prescription medications that they take. For example, they are taking yung phenylpropanolamine, chlorphenamine. Chlorphenamine causes drowsiness, right? So, halimbawa, anti-anxiety agent siya and then nag-take siya ng chlorphenamine. So, we expect na nagkakaroon ng possible additive effect or possible synergistic reaction. 'Di ba? Pag sinabi nating synergism, mathematically speaking, it's 1 plus 1 equals 3. 'Di ba? You know this in pharmacology. So, there. So, non-prescription medications can also affect or can also contribute to drug interactions. And then, drug abuse, di ba? The dose of the drug or medication may also be a contributing factor to drug interaction as well as the patient's non-compliance. Okay, we may prevent patient's non-compliance by um, giving the right counseling to the patient. Okay, so what are the causes of drug interactions or effects? This is effects, no class, because drug interaction might cause the decrease in drug activity with diminished efficacy. Increased drug activity with exaggerated or unusual effects. So these are the effects of drug-drug interaction. So drug-drug interaction, hindi lang naman siya possible na magkaroon ng exaggerated or unusual effects. Okay, possible din na mawalan ng effect yung drug, yung isang drug. Okay? Drug A, for example, if taken with drug B, drug A's efficacy will diminish or decrease in drug activity. That's a possible interaction. Another is drug A and drug B, na drug A and drug B. So drug A if taken with drug B, so the drug B ay magkakaroon ng synergistic effect, let us say. Okay, so these are different effects of drug interactions. And then we have to be careful also with drugs with the narrow therapeutic index. Okay, and then also the steep dose response curve. So especially these drugs, pag sinabi nating steep dose, no, just a little adjustment in the dose might also cause toxicity. So anticoagulant examples are anticoagulant, oral contraceptives, and anti-epileptics. Okay. So this next excuse. So next is the drugs with narrow therapeutic index. So why do we need to know this? Because if we see these drugs already in the patient's chart or sa reseta ng pasyente, we need to be aware, okay? We need to be vigilant of the other drugs that are prescribed with this because these are drugs with narrow therapeutic index. So kapag merong interaction with the other drug, okay, possible na a slight increase or decrease in the drug concentration might cause already toxicity or loss of efficacy. Okay? So I hope you know the uses of this, no? Yung mga to. If not, okay. So I will give you this as an assignment, okay? So kindly submit, okay? So the indication or the yes the uses of these drugs. Okay? So itong anticoagulants giveaway na 'yan. Ito aminoglycosides giveaway. So itong mga to, if you are aware of this aspirin, digoxin, medyo familiar na kayo sa mga 'yan, no? Aminophylline, you had your pharmacology already. So I guess you're familiar with this, no? Some- And then next is using drug interaction information. Okay, so interacting drugs can still be usually used together. As I have mentioned, 'di ba? There are some drug interactions class that can still be used together even if there is an interaction. So ibig sabihin, hindi naman ibig sabihin na meron drug interaction, ay hindi na po pwede. Hindi siya pwedeng ipag-take. Halimbawa, nasa hospital setting kayo, tapos nakita nyo, nireseta ni doc. Halimbawa, let us say, aspirin, tsaka clopidogrel. Aspirin is an antithrombotic agent, and then clopidogrel is the same. So, ay, doc, hindi po pwedeng ipagsabay itong dalawang to. Baka ganun yung gawin. Hindi, di ba? We have to know, class, that what what do we need? What is our focus? Ano ba yung reason ni doc kung bakit niya pa rin nireseta? Kasi possible magkaroon ng synergistic reaction or additive effect. However, baka naman hindi talaga kaya ni aspirin alone or hindi kaya ng clopidogrel alone. 'Di ba? So we need to analyze also. 'Di ba? Kaya nga yung first step natin is read and analyze the prescription. Okay? So in our interacting drugs can still be used together as I have mentioned a while ago. If the interacting drugs class they have yun nga meron silang drug-drug interaction, possible remedy is kapag yung absorption yung affected, okay, possible na lagyan mo muna sila ng time interval. However, in some instances when the metabolism is the one that is being affected, no, ang gagawin is dosage adjustment. Okay, and then beneficial interactions. Yes, there are beneficial interactions. So, meaning to say, nangyayari, sometimes there are two drugs that are taken together and then the other drug will prolong the effectivity of, excuse me, of the other drug. Okay? So, it's beneficial. Siyempre, for example, talagang kailangan mong pahabain yung effect ni drug. So, that's beneficial. However, in some instances, if you want it to be excreted, excreted from the body, of course, iiwasan mo yung interaction na yun. Okay? And then, we have to know the nature of reports of the different drug interactions, the depth of information, okay? Current literature, kaya nga for us pharmacists, di ba, lifelong learner talaga dapat tayo. And then recommendations and therapeutic alternative. So in some cases, class, if the interaction of two drugs are very serious, no? Or pwedeng mag-cause ng life-threatening condition or interaction, then there should be a therapeutic alternative. Kung meron namang ibang alternative, then yun na lang ang gagawin. Magkakaroon na lang ng substitution of the medication. Okay? So, patient's variability should also be considered, okay, in drug interaction because as mentioned, no, the age of the patient should be well considered, and then genetic factors like for example, there are some medication, 'di ba, yung you know this already in organic medicinals, yung ating metabolic pathways like acetylation, yung mga meron tayong mga fast acetylators, we have slow acetylators, 'di ba? Usually Asians are fast acetylators. Okay, and then we will discuss them in the next lessons pa, no? This discussion class is parang warm up, okay, for our deeper understanding of the different drug interactions. Okay, the renal function and the hepatic function should also be considered, and then alcohol consumption. In alcohol consumption class, the ones that we have to remember is that when there is chronic alcoholism, so meaning to say, laging umiinom yung pasyente, the patient is um, addicted to alcoholism or is an alcoholic, no? Like araw-araw talagang umiinom, there's a possibility that there's the patient's liver, okay, might have induction, okay, or increase in the activity of the enzymes. So usually, patients who are alcoholic, okay, pag alcoholic yung pasyente, minsan mas mababa yung efficacy ng gamot sa kanila. 'Di ba sometimes tayo kapag uminom na tayo ng ah, analgesic, tapos saglit lang mawawala na yung sakit natin. But for chronic alcoholic, no, mga alcoholic natin na patients, even if they take NSAIDs, no, hindi agad mag-epekto or bawas yung efficacy. Okay? There's lesser efficacy of the medication. This is because of the enzyme induction. We will discuss this pa, no? Yung enzyme induction and enzyme inhibition. So, enzyme induction class, what happens in enzyme induction? So, there is, from the word itself, no, nai-induce, okay, or nagiging mas active yung mga enzymes para mag-metabolize ng gamot. So, ang keyword natin dyan, keyword natin dyan, keywords natin dyan is when there is enzyme induction, remember na parang masipag yung mga enzyme, okay, na mag-metabolize. So, kapag mas madami yung nagtatrabaho, mas active yung nagtatrabaho, agad matatapos yung trabaho, okay, ma-excrete agad yung gamot. So, possible magkaroon ng decrease. Okay? Decrease in the efficacy of the medication. When there is enzyme induction, the effect is always decrease in the medication. Okay? Decrease in the efficacy of the medication, I mean. Okay? In chronic alcoholism, ang nangyayari is nagkakaroon nga ng enzyme induction. But for people who are not chronic alcoholic, okay, bawa uminom ka lang ng alak, ngayon lang, or 2 days lang, 2 days ka pa lang naman umiinom. So, possible na there is enzyme inhibition naman. So, when there is enzyme inhibition, the possible effect is, of course, the opposite. So, when there is enzyme inhibition, so konti ang mga enzymes na magme-metabolize dun sa gamot. So, there is a possibility of accumulation of the medication and may result to increase in the dosage of the medication or toxicity. Okay? So, kahit isa lang tandaan mo doon, enzyme induction, there is increase in the enzyme activity, therefore the effect is decrease in efficacy. Diba? And then smoking, it's the same as chronic alcoholism. There is enzyme induction. So if the patient is a chronic smoker and then the patient was prescribed with the medication, there's a possibility that, or most of the time, magkakaroon ng decrease in the effect of the drug because the patient is a chronic smoker. Okay? And then the diet should also be considered sa mga drug interactions. Like for example, yung mga drugs that are SSRIs, ganun. Okay, we will discuss this one by one, no? As in deeper. And then individual variation or idiosyncratic reaction. Idiosyncrasy is yung pagkakaiba-iba ng mga individual, di ba? Remember class that no two persons are alike, even twins are not alike. Okay? So now we proceed with the topic talaga, which is therapeutic incompatibilities. So it is classified into two. Okay, so pharmacodynamics and pharmacokinetics. I'm sure that you know this uh, two branches or sub-classification of pharmacology, pharmacodynamics, and pharmacokinetics. I know that you know the definition of pharmacodynamics, that is what the drug does to the body, and then pharmacokinetics is what the body does to the drug, which is also important no in understanding therapeutic incompatibilities, pharmacodynamics, and pharmacokinetics. When we talk about pharmacodynamics, type of interaction or pharmacodynamics therapeutic incompatibilities, we're talking about the change in the effect of the drug, okay, without changing its drug plasma concentration. There's a change in effect, okay, but there is no change in the drug plasma concentration. So, paano nangyayari yun? So, for example, yung classic example natin kanina, chlorphenamine. If chlorphenamine is taken with another anti depressant anti-anxiety drug, okay, or a depressive drug, for example chlorphenamine and a depressive agent, so possible additive or synergistic effect, okay. So there's a change in the effect of the drug kasi nga nagkaroon ng synergism, let us say, or additive effect, no. By the way, iba yung additive sa synergistic, di ba? Mathematically speaking, additive 1 plus 1 equals 2. If it is synergism, 1 plus 1 equals 3. However, there are some instances nga like for example, yun nga, chlorphenamine and anti-anxiety agent. It depends kung anong anti-anxiety agent. So if these two are taken together, then the effect would be great. Okay? Mas magiging drowsy yung patient natin. So there is a change in the effect of the drug because if drug A and drug B are taken together and then it resulted to increase in drowsiness of the patient. So there's an change in the effect of the drug without a change in the drug plasma concentration. So meaning to say, kahit i-check mo pa si chlorphenamine, halimbawa ang chlorphenamine dose mo is 25 milligram and then ang effect niya is drowsiness, of course, no? And then nagkaroon ng blood extraction, same pa rin siya dun sa inadminister hanggang dun sa inexcrete dun sa or inextract sa blood. So kung pares pa rin siya or minor difference, of course kasi nag-undergo na siya ng absorption, distribution, metabolism. So kapag ganon, then there is no change in the drug plasma concentration. Again, class, in pharmacodynamics, there is a change in the effect of the drug, okay, without the change in drug plasma concentration. Hindi nag-iba yung amount ng drug sa katawan, pero nag-iba yung epekto niya sa katawan ng tao. Okay? And then, I hope we're clear with that. Meron namang notes na, you can browse on it, yung notes na binigay ko sa inyo. It's a summary of Remington actually. And then pharmacokinetics class, therapeutic incompatibilities. It has something to do with the absorption, di ba nga, kinetics, absorption, distribution, metabolism, and excretion of the drug. Okay? Like for example, drug A is taken with drug B. Drug B affects the absorption of drug A. So, if drug B is taken with drug A, naapektuhan yung absorption ni drug A, so what do we expect? If there is a change in the absorption, distribution, metabolism, or excretion of the drug, so there would be a change in the drug plasma concentration. Definitely, di ba? Kung halimbawa, 25 milligrams siya, but then tinake mo siya with another drug, na nag-decrease yung absorption ng 25 milligram. So, expected sana na yung 25 milligrams ma-absorb siya ng body However, with the presence of another drug, nabawasan yung effect or the absorption ni drug A, then that is a pharmacokinetic type of interaction. Okay? Pharmacokinetic type of interaction is a type of interaction wherein there is a change in a drug plasma concentration. Okay? Opposite lang siya, no, ng pharmacodynamics. Yung pharmacodynamics, merong change dun sa effect niya dun sa tao. However, if you check the drug plasma concentration, hindi naman siya nag-iba. Sa pharmacokinetics, the drug plasma concentration is changed, and of course, the effect is also changed. Okay? So I hope we are clear on this pharmacodynamic and pharmacokinetics type of interaction. So you can read the Remington also, no? So in this one, we proceed with the examples, no? Again, this is a warm up of our pharmacokinetic and pharmacodynamic type of interaction. So hindi muna tayo masyadong magdi-detail-detail. But for this one, pharmacokinetic interaction under absorption, under change in pH, okay? So, pinaka-common drug interaction, bisacodyl or dulcolax, which is a laxative. Okay? And then, plus antacids or H2 antagonist or milk, okay? Or any other drug that increases the pH of the stomach, it might result to severe irritation. So, bakit nagkakaroon ng severe irritation? Plus, drug interaction is important, okay, in our daily lives as a pharmacist because yun nga in the community setting when a person asks you or the patient asks you, 'di ba? Bakit hindi ko pwedeng isabay yung Dulcolax tsaka yung Kremil S? So, kasi po mai-irritate yung tiyan nyo. Eh, what if nga yung pasyente mo is masyadong matanong? Paano nangyayari yon? You should know the answer, 'di ba? Or if the physician asks you, why do you recommend another drug? Or why do you need to change the time? 'Di ba kasi nga nasa absorption tayo. Bakit kailangan mag-observe ng time interval sa bisacodyl at sa antacid? So you have to have your reason or rationale. Okay? Hindi pwedeng kasi po magkakaroon ng irritation. Bakit? You should know why. Okay? So in this one class, Bisacodyl is an enteric coated tablet. Remember, an enteric coated tablet class is designed to dissolve in the small intestine. Diba? It is manufactured and it is designed, no, to disintegrate and release, okay, in the small intestine. However, since hindi naman tao si Bisacodyl, syempre hindi naman nag-iisip ang tablet, di ba? So, once the bisacodyl, okay, is taken by the patient and then nag-take din siya ng antacid, si bisacodyl might disintegrate in the stomach. Because remember, the design of bisacodyl is enteric coated tablet which should be absorbed or disintegrate in the basic environment or a neutral environment. Okay? Pag na-feel niya na nandun na siya, okay, na misinterpret ni bisacodyl, nasa stomach pa lang siya, 'di ba, acidic ang stomach. Pero dahil nag-take ng antacid, nag-neutralize or naging basic yung stomach ng pasyente, then bisacodyl will disintegrate right in the stomach because parang misconception ni bisacodyl na feel niya na nandun na siya sa basic environment. So, magdi-disintegrate na siya. Okay? And then, since bisacodyl is quite irritating to the stomach, it might result to severe irritation. Okay? Hindi ko masyadong lalaliman muna ngayon, no? So, medyo preview muna tayo. Ketoconazole plus antacid or milk or H2 antagonist, no, it might have a lesser therapeutic effect. The ketoconazole, the absorption of ketoconazole might be decreased with the presence of antacid, milk, or any basic food or drink or medication because ketoconazole class is best absorbed in an acidic environment. Okay? So, next is pharmacokinetic pa rin, under absorption, and the alteration of motility and rate of gastric emptying. Okay? If a cathartic, okay, alam na natin yung mga cathartic, di ba? Castor oil, yan, yung mga cathartics, and then plus other drugs, then nagkakaroon ng decrease in the efficacy of the other drug. Because the motility, okay, the alteration of the motility, yung paggalaw ng at if the peristaltic movement of the stomach and the small intestine is being affected, then there would be possible, actually this one, it can be an increase or decrease in the effect of the drug. Okay? And then tetracyclines plus metal containing products, zinc, aluminum, magnesium, okay? So there's a formation of complex, and then it will be poorly absorbed, okay? Because of the formation of the complex. Then fluoroquinolones, ano yung mga fluoroquinolones? Yung mga quinolone, di ba? And then plus metal containing products or sucralfate. Sucralfate is ano ba yun? Nakalimutan ko yung mismong term. Pero it's a protective agent, okay? Usually for the stomach. Okay? So this might cause reduce in the serum absorption of the fluoroquinolones. Okay? Again, hindi ko muna lalagyan ngayon para hindi kayo masyadong matoxic. Okay? So, another common drug interaction is anticholinergic medications. So, ano ba yung mga anticholinergic medications? Antispasmodic agents such as Buscopan, hyoscine and butyl bromide, or ano pa kasi yung iba. Okay, so yun na muna for now. And then other drug, so there might be a decrease in the drug absorption because remember yung anticholinergic agents or antispasmodic agents class, so atropine, another example pala for anticholinergic agent, no? So kapag merong nagkaroon ng effect dun sa motility, no? Basta uminom ka ng medication na nagkaroon ng change in the peristaltic movement ng ating stomach or small intestine, then expect that the other drug will have a decrease or an increase in the absorption. Okay, and then metoclopramide is another one, or it's an ano bang tawag dito? Dali, nakalimutan ko yung term. Yung kontrasuka siya, kontrasuka talaga. So, metoclopramide or Placil. Okay, that's the brand name. Nakalimutan ko yung term. Okay, and then plus other drugs since it affects the motility pa rin, okay, of the other drug. So, possible decrease in the effect of the other drug. Okay? Hindi ko pa rin maisip yung metoclopramide. Okay, next is anti-infective agents. If it is taken with food, then there is a possible decrease in the drug absorption. But there are some exemption. Okay, yung amoxicillin is an exemption. Pwede siya to be taken with food. Okay? Madami pa tayong explanation dyan. And then, effects of food on drugs. So, these are examples, no? Acetaminophen, aspirin, okay, and digoxin. So, possible decrease, delayed, or delay in the drug absorption. ACE inhibitors, okay, there's a significant decrease in serum drug levels. And then fluoroquinolones, so avoid taking with antacids because there's a significant decrease in the drug absorption. So the danosine, okay, food in general are acidic, so it significantly decreases the drug absorption. And then this one, griseofilbin, itraconazole, lovastatin, spironolactone. So this should be taken naman, no, with high fat meals because especially the griseofulvin, no, it improves drug absorption if it is taken with food. Then famotidine, decrease drug absorption if it's taken with famotidine. Ketoconazole, so it should be, ito yung na-mention ko kanina, it should be taken with acidic food juices and sodas because it will significantly increase the drug absorption, especially if you are dealing with fungal infections, diba? It is desirable that the ketoconazole will have an increase in drug absorption. And then other examples, levodopa, penicillin, tetracycline, erythromycin. So, a high carbohydrate meal, okay, will decrease drug absorption. And then note that when the increase or decrease absorption effects of food are undesirable, so take with an empty stomach. Either 1 hour, okay, before meal or 2 hours after meals. So, other examples, theophylline plus food, decrease drug absorption. But there are some considerations here, class. It depends if it is a film-coated tablet or a immediate release tablet. Okay? So, common drug interactions, another example is alendronate or risedronate. So, this one class is an ano ba tawag dito? anti for osteoporosis. Okay? It's used for osteoporosis. So, if it is taken with food, orange and juice, coffee, and even mineral water, there is a significant reduction in the bioavailability. Okay, another thing that we have to remember with alendronate class is that the patient should stay upright, in an upright position. Okay, bawal siyang yumuko. Okay, so, dapat before meals to. And then the patient should remain in an upright position because there's a possibility of irritation of our esophagus. Okay? Carbos and miglitol, ito naman is different from other anti-diabetic agents. So, carbos and miglitol plus food, it will have its maximum effectivity. Okay? Mas mataas yung effectiveness niya. Okay, so again, the mechanism of actions of this will be thoroughly discussed to you. Okay, don't worry about it. And then grapefruit extract. So if it is taken with calcium channel blockers, HMG coenzyme A reductase inhibitors, or cyclosporin, then it might result to high bioavailability. So this one class, grapefruit extract kasi, no, is an enzyme inhibitor. So what did I mention about enzyme inhibition? So yung enzyme inhibition, nagkakos siya ng mas mataas na effect ng drug. Okay? High bioavailability. Okay? So, ayun na pala yung end of this slide, okay? Because we will have deeper understanding of this. This is a partial. Yes, it's an introduction, a warm up for our drug interaction. So again, on Thursday class, we will have a pre-test regarding this. So you need to read the whole chapter. So I will just check kung sino yung mga nagbabasa talaga. Okay? So, medyo 11 pages siya, or I think 10 or 11 pages yung Remington, therapeutic and compatibilities or drug interactions, no? So, you need to read everything and then anything may be asked. However, hindi naman siya recorded as a quiz. Okay? It will just be an activity. Okay? Pag-iisipan ko if it is, hindi, sige. It will be an activity on Thursday. Okay? At 10 a.m. again para hindi kayo pala maagang gumising. Okay? So, thank you so much for listening. So, there, good night. Ay, good night na sa akin, class. Good night na talaga sa akin. Kasi kanina hindi ako nakapag-record ulit. Okay? Because, iniistorbo ako. Okay? Thank you so much for listening. Goodbye.